Hello, my name is Vivencio Barrios. I'm clinical cardiologist. I'm working at the University Hospital Ramón Cajal in Madrid, Spain. And it's my honor to present you this oral communication focused on the HABITA project, a project to study the smoking habit among patients and faced with their withdrawal. According to a national survey, the Edades survey, performed in 2019 and 2020, in Spain, the percent of smokers who do not consider quitting is between 37 and 40%. And unfortunately, this is increasing. Thus, despite intensive healthcare campaigns, we could say that the strategies to quit the smoking habit are frequently unsuccessful. And among certain group of patients, this is especially difficult. This is especially uneasy. Well, with this idea to check the how is the smoking habit in different population of patients, we performed the HABITA project, a project promoted by the Spanish Patient Forum and with the collaboration of the Aragonese Association for Mental Health, the Association of Coronary Artery Disease Patients, and the National Federation of Associations of Respiratory Diseases. Thus, the objective of the study was to study the smoking habit in 3 groups of smokers belonging to these 3 patient associations, aimed to analyze the consumption, the degree of addiction, the history of withdrawal, and the motivation of it, as well as future proposals. From March 2021 to 2021 and to May 2021, patients answered an anonymous electronic questionnaire, which was endorsed by the Spanish Society for Healthcare Quality, the SECA Society, and was approved by the Research Ethics Committee of Camilo José Cela University in Madrid, Spain. We had the special collaboration of Philip Morris, Spain. This is our study population. There was a study of 111 patients, 37 patients per each group of subjects. And as we consider that we had a heterogeneity of 50% and a confidence level of 95%, the minimum sample we calculated should be around 97. And this will represent a sample error below 10%. We perform a competitive recruitment, so the first 37 patients for each subset of subjects who respond and completed the questionnaire were included in the analysis. So we have a homogeneous group of patients from mental care, healthcare, from coronary artery disease patients, and from respiratory patients that completed the HABITA project. Concerning to the results, there were 111 accessible smokers or ex-smokers, 37 from each study group, with a mean age about 61, 62 years. Almost half of the patients, 49% to be exact, were currently smokers, and with an average of 17 cigarettes per day of consumption, and with a history for more than 28 years. The yearly PAX index was over 24, and the mean Firestrom value was 4.26. When we checked the motivation to quit smoker, the main motivation was awareness of the damage of their health. However, 39% of these subjects, of these patients, didn't want to quit smoking. Only 19% will try to stop in the coming weeks, so the proposal was not optimal, was far from optimal, and 91 tried to stop the habit at some time, but 69 have relapsed, mainly due to stress or anxiety, more than half of the patient, almost two-thirds of the patient, 74%, but also due to just dissatisfaction for a smoker in 13% of these subjects. 60% try to quit by themselves with any kind of help, and only 33% turn to a health professional, evaluating the effectiveness of the available supports as low, really, and actually very small. Here are the support strategies that people claim: the individual psychological therapy, the group psychological therapy, the nicotine, patches or gum, medicines, electronic cigarettes, or other kind of means. But the success was not high, as you could see, because a lot of them continue going smoking. So the conclusion, very briefly, the population should be undoubtedly discouraged from smoking, and we should promote educational campaigns against tobacco use. These campaigns, these strategies are mandatory nowadays, but for those subjects who are already smokers, and seems that quitting it seems that quitting is an unattainable goal for many people. It's not easy, and many of them do not want to stop the habit. So in this case, try to reduce the harm of traditional cigarettes. Exploring alternatives and several devices becomes a regional approach. And I think we could support this kind of alternatives to those patients who do not want to quit quit smoking, or for those subjects who simply cannot quit smoking. Thank you very much for your kind attention.